COVID hospitalizations statewide are at their highest level since May of 2020.
So what do those numbers mean? And what are hospital administrators doing to handle this spike?
The News Cell's Kevin Vesey joins us live from Nassau University Medical Center in East Meadow to explain. Kevin.
And Rich, hospitals across the island, including NUMC, are really starting to feel the pinch of this current surge. In fact, some administrators are now having to implement new policies to make sure there's enough space for everyone.
Our resources are strained.
Dr. Grace Ting at Nassau University Medical Center says her hospital's COVID admissions have doubled in the last week. The facility has a total of 64 ICU beds. Right now, just one is available.
Because the sheer volume of patients that are testing positive, you still have the rise of people who are severely ill.
The sharp increase, part of a troubling trend across Long Island. Back on Christmas Eve, there were 793 COVID hospitalizations. By January 3rd, that number had jumped to 1,833, enough to prompt the chief medical officer at St. Catherine of Siena Hospital in Smithtown to announce a policy change aimed at freeing up beds. Writing in a memo to staff today, St. Catherine of Siena Hospital is under siege with another COVID-19 surge. We are currently challenged with extremely high volumes in our emergency department, in our intensive care units, and throughout the hospital. For cases involving stable patients that do not require inpatient level of care, we ask that you continue any other workups or testing possible as an outpatient. The same policy went into effect this morning at NUMC, and right now work is underway to increase the size of the hospital's ICU.
We do have capacity for additional isolation rooms and ICU beds. Right now we're working on the staffing.
It's incredible, Kevin. We all wish we weren't in this position, but yet here we are. Did NUMC provide any information about the severity of the COVID cases that they're seeing in the hospital?
So they did to a certain extent. Right now, about 60% of the people who are hospitalized here for COVID are being treated for actual COVID symptoms. The other 40% are people who came here for something else and just so happened to test positive. It should be noted, however, that the 60% who are suffering from real COVID complications are mostly not vaccinated.